Hello and good evening, everyone. I am Amanda Hollander, and I am honored to serve as Executive Director for the Head and Neck Cancer Alliance. And I am thrilled to be joining this special combined session tonight featuring the Exercises Medicine, Moving Through Head and Neck Cancer, followed immediately by the official Alliance Move-A-Thon Kick-off. During this webinar, we'll explore the powerful role that physical activity can play in improving cancer outcomes. You'll gain practical strategies and guidance designed for patients, survivors, and caregivers. We're excited to share insights from a physical therapist and hear inspiring stories from two very active head and neck cancer survivors. Following the webinar, we'll remain together for the 2026 Alliance Move-A-Thon Kick-off with Nancy Bonfield, my colleague and Alliance Development Director, who will introduce this year's initiative. This webinar is also going to be recorded for those of you who may need to leave early, and we'll provide a survey afterwards for you to provide feedback on our webinar. Please know that we welcome questions. We really want this to be as interactive as possible, so feel free to use either the chat or the Q&A, introduce yourselves, and we'll interact and get to as many questions as we can during the webinar. So to kick us off, I would first like to introduce three-time cancer survivor, Toby Hanna. Toby is intentional about caring for his health through a nutritious diet, regular exercise, and stress management. Now 57, Toby is a prostate cancer survivor, a skin cancer survivor, and a head and neck cancer survivor. In May 2022, he was diagnosed with HPV-attributed squamous cell carcinoma. And for Toby, survivorship means actively managing long-term side effects, including dental issues, carotid stenosis, fibrosis, dysphagia, which is difficulty swallowing, lymphedema, and dry mouth. He believes that exercise in general has played a significant role in his smooth recovery and positive outcomes throughout his cancer journey. And we're so happy you're joining us tonight, Toby. Thank you.
Thanks so much for joining our webinar today. And it really means so much for me to be here with all of you. This community is so important, and I want to help however I can. And this topic is a great way for me to do that. So I appreciate being here and appreciate everybody being here. There's really only so much that we get to control on our cancer journeys. I'm sure everybody feels that, who's gone through it. But feeling like we're doing what we can is a really powerful coping and hoping mission to undertake. To help avoid cancer, endure treatment, recover from treatment, and have the best quality of life and survivorship, I believe our primary controllables are an anti-cancer diet, keeping stress levels low, and regular exercise. It just seems to all boil down to those three. That's me defending my state champion title last summer, by the way. You can read more about my cancer journey on the ambassador pages on Head and Neck Cancer Alliance's website. But briefly, as Amanda gave us a little bit on, I'm a three-time cancer survivor. Skin cancer has been around, not the scary stuff, the basal cell, the squamous cell stuff. It's been around for me since I was in my 20s. I was just at the dermatologist yesterday, and you can't see it, but we got a biopsy on my elbow and a biopsy on my knee. There's always something. Prostate cancer was my birthday present when I turned 50. I had a prostatectomy in 2018, and my PSAs have been non-detect since then. The head and neck cancer story is the most recent one, of course. I was diagnosed with head and neck cancer in 2022. That was for my 54th birthday. It was HPV-attributed squamous cell carcinoma with a primary tumor in my right tonsil, and it had spread to a single lymph node under my right jaw. A diagnosis and treatment planning was a dark time, as it is for all of us, but we pushed forward. I had a neck dissection to remove 50 or so lymph nodes, including the cancerous one. That was back in July of 2022. A week later, I had transoral robotic surgery to remove the tonsil, part of my tongue, part of my palate. And man, they took such good care of me, and what a remarkable experience it all was. It got tough again, though, at my three-month PET scan, where we found a new tumor that wasn't there previously. It was in my nasopharynx, in the back of my nasal passage. And that not knowing period was the toughest time on my journey. Looking back, and at the time, I knew it was. The painful thoughts about, is this my last Thanksgiving? It was over the holidays, of course. My last Christmas. Do I need to record videos for the kids? You know, all those things that you have to think about and still find a way forward. Surgery was not an option, but we found the strength that we pushed ahead with 7 weeks of radiation and chemotherapy. Again, my team took such good care of me. That picture is my team captain, Peg, my caregiver of the year every year. Again, what a remarkable time through radiation and chemo. I just can't say that enough. And I did well, almost embarrassingly well. I remember I had to ask my radiation oncologist if the radiation and chemotherapy was working because I felt good, okay, in my 6th and 7th week. And I thought I had to feel a lot worse for the treatment to be working. After all that, I'm a different person. I know that, and I like that, especially in giving back. I mentor patients, which is one of the most rewarding things I've ever done in my life. They go through such tough times, way tougher than I have. Helping researchers understand the patient side of head and neck cancer is another thing that I love doing, and supporting patient-focused organizations like Head and Neck Cancer Alliance. Good news is on February 22nd, just a few weeks ago, I passed 3 years since my last treatment, and I've had clear scans all along the way. Everybody give me some good energy on Monday. I've got my next round of scans. My annual scans are coming up on Monday, so wish me good luck. That's me on the top step of the podium at a local bike race last summer. If you haven't figured out yet, I'm a cyclist and proud of it, happy to be. I mentioned that I did well throughout the surgery, radiation, chemo, and all the physical and emotional challenges along the way. What I mean by that is that I minimized the troublesome side effects like mouth sores, lymphedema, swallowing trouble, taste loss, weight loss, feeding tubes, fatigue, depression, darkness. And I recovered with forward progress. I got out of the woods, and there were no setbacks from there on. I kept my focus, control, purpose, momentum, and importantly, I think my sense of humor and humility. And regular activity and exercise, I know, played a huge role in my emotional and physical state. We talk about the benefits of exercise, and I believe that it's as much about the activity as it is also about the mindset that goes with it. So the two go hand in hand. You've got to have a strong power and momentum to move forward, and you've got to do it with movement and activity. A friend of mine who's a head and neck cancer survivor that's gone through a lot more than I have framed our message like this: helping people understand that they need to attack cancer like an athlete, not necessarily with intense training, but with a positive, intentional mindset. So orchestrating that around movement, activity, exercise, and exercise that you enjoy, even love, that I think is the secret sauce. Another great picture that I love, that's me climbing Mont Ventoux in France a bunch of years ago. If anybody knows that mountain is a regular appearance in the Tour de France, and it's a beast. Long, hard fight. So it's a proper metaphor for our cancer journeys, I think. But we're all in different places. What I do and did during my journey is not the only answer. The point is to recognize the power of movement and exercise, form a plan for it, set goals, and take it on with a positive, intentional mindset. What did I do? In short, I pushed my routine of daily walking, daily stretching and strengthening, and 5 to 6 days a week of cycling. I pushed that hard leading up to surgery and treatment so that my body was as fit as it could be to endure the punishment that it was going to take through surgery and treatment. I kept that routine going during treatment, but gentler. And then after treatment, I worked back gradually to where I was through recovery. During treatment, I added 1,000 calories to my daily diet, from my 35 years of cycling, I know that the fuel that my body needs for different training periods, I knew radiation and chemo were going to take my body to places it had not been before. It's going to make it work really hard. And I knew that extra fuel would be required. So with that extra 1,000 calories a day, there was no weight loss during that round of treatment. And I had the energy to make it through. Two quick anecdotes that I'd like to share that are kind of fun for me, but they're also triggers for the waterworks. So watch out. I'm just warning you. It's very hard to talk through these without getting misty, but give you a chance to just feel what it was like in my shoes, and I'm sure you'll relate. There were little things like taking the stairs from the bottom of the parking garage up to the radiation and chemo floors instead of cramming into the elevators with all the other patients. It really helped me feel like I was in control. It made my wife tired. Sometimes I pushed her up the stairs, which took extra energy, but it was fun. We laughed. She had a lot of weight to carry. Then there was a powerful memory of one day during my third or fourth week of radiation. The January weather in New Jersey was good enough for me to head outside for a ride. It was in the 40s, but sunny. I wasn't sure how I'd feel. But I rolled out and up the hill from my house, and I felt the sun on my back and the strength in my legs, and I just began weeping. There were tears of joy, the feeling of the sun, my legs responding as they always have, the confidence that I can do this, and it just all washed over me. And that moment has stuck with me, and man, it got me through. It was good for at least a week or two of strength and hope during my treatment period. So the power of movement, right? Wrapping it all up, I love this memory too. That's Ambassador Toby being given the royal treatment at a year-end town hall for one of Johnson & Johnson's amazing oncology teams. They had me come in and speak, help them understand the patient's experience as they're developing new treatments for head and neck cancer and making all of our lives better. What a rewarding experience. And I have to thank Head and Neck Cancer Alliance for putting me on that. And in summary, I believe the physical and mental commitment that I put into attacking cancer like an athlete paid off. No lymphedema, no mouth sores, no feeding tube, no depression, lots of laughter, good sleep, kept up with work, and I became a new and better me. So lastly, do some planning. If you don't know where to start, there are published guidelines on exercising during head and neck cancer journeys. Start where you are with activities that you know you enjoy. Don't try to immediately become something you're not. Treat yourself gently. Find exercise buddies for the extra lift that you'll get. And most of all, move. Thanks.
Thank you so much, Toby. That was incredibly moving and inspiring, and also just very helpful. And we are grateful for all you do for the Head and Neck Cancer Alliance and for the broader community, and just appreciate you so much. Thank you for sharing today. And also, there have been some great questions coming in the chat, so I just want everyone to know that we will get to those either during the session in the chat, or if not, towards the end. And now I have the pleasure of introducing Dr. Margaret McNeely. Dr. McNeely is a professor, Department of Physical Therapy and Department of Oncology, and Director of Cancer Rehabilitation at the University of Alberta and Cancer Care Canada. Dr. McNeely's research and therapeutic focus centers on impairment-based cancer rehabilitation, which is a specialized area that integrates physical therapy and exercise interventions to prevent or reduce cancer-related impairments, and that includes pain, fatigue, and lymphedema. Her overarching goal is to enhance cancer survivors' functional abilities and improve their participation in life activities. So thank you for joining us today, Dr. McNeely.
Thank you for having me. So what I'd like to talk about today is when we think about cancer care, we usually think about treatments that fight the disease. But recovery doesn't end when treatment ends. Many people finish treatment feeling weaker, more fatigued, and unsure of how to recover and get back to their usual activities. Increasingly, we recognize that movement plays an important role in recovery. And that idea is at the heart of an initiative in the United States called Moving Through Cancer. With Moving Through Cancer, the idea is simple. Exercise rehabilitation should be part of cancer care, not something patients are left to figure out on their own. And every patient should be assessed, advised, referred, and supported in terms of exercise through their cancer treatment and recovery. Research over the past decade has shown that appropriate exercise during and after cancer treatments can improve outcomes. In 2019, the American College of Sports Medicine reviewed hundreds of studies looking at exercise in people with cancer. They found strong evidence that exercise improves fatigue, physical functioning, anxiety, depression, and overall quality of life. There's also growing evidence that exercise supports bone health and improves sleep. So the message from the research community is very clear. Appropriate movement is both safe and beneficial for people living with and beyond cancer. Even though we know that movement helps with recovery, many people living with cancer are not physically active. In fact, fewer than 1 in 3 cancer survivors meet recommended physical activity levels. For people with head and neck cancer, the challenges can be even greater. Treatment can affect the shoulder and neck, making movement painful or difficult. Fatigue, nutrition challenges, and changes in strength and balance can also make exercise feel overwhelming. So while we know exercise is beneficial, many patients with head and neck cancer need more guidance and support to get started. And that's really what I'd like to talk about today. Because of these challenges, movement during recovery from head and neck cancer may look different for different people and at different stages. And I always say to my patients that I have 3 targets in terms of exercise. Sometimes the goal is rehabilitation, targeted therapeutic exercise to restore movement and function, like strengthening the shoulder after surgery. Sometimes the goal is to rebuild fitness, improving strength and stamina after treatments such as concurrent chemotherapy and radiation therapy. And sometimes the goal is simply staying active through everyday movements. For example, some individuals, when they're undergoing cancer treatment, don't feel well enough to take part in physical therapy and/or exercise programs, but we just want them to move as much as they possibly can during their day to maintain their health. My work in the head and neck cancer field actually began in the therapeutic exercise space. I was working as a physical therapist in our cancer hospital and was brought into the head and neck cancer clinic to help patients with treatment-related impairments. Initially, this meant helping people with trismus or people having difficulty opening their mouth after radiation therapy treatments. But as I began to see more patients, I noticed that many were also struggling with shoulder and neck dysfunction, and shoulder problems in particular were very common. So that led me to start asking a different question. What could we do to help improve shoulder and neck recovery after treatment? To answer this question, it helps to understand what's happening in the neck and shoulder after head and neck cancer treatment. And you heard Toby talk about his neck dissection procedure. So there are a few reasons why this dysfunction happens. One is surgery. So during a procedure such as a neck dissection, where they remove lymph nodes in the neck region and check them for the cancer, the spinal accessory nerve, go back, it's shown there in the yellow. You can see it from the ear down diagonally across to the muscle at the back of the shoulder and neck. And this nerve can be injured during the surgical procedure. And it controls 2 important muscles: the sternocleidomastoid muscle, which is on the front and the side of your neck, as well as the trapezius muscle at the back of your neck and shoulder. So when the nerve is damaged, the neck may feel tight and the shoulder may feel weak, heavy, and painful. Radiation therapy can also play a role, causing stiffness and tightness in the muscles and tissues of the neck over time. So for many patients, it isn't just fatigue from treatment. There can be real changes in how the neck and shoulder muscles work. So here's another view of that trapezius muscle. And as you can see, the muscle runs from the back of the neck to the bottom of the ribs and to the points of both shoulders. This muscle helps us with our posture, keeps our head in alignment, controls the shoulder blades so that we can lift and carry objects. And the upper and lower parts of the muscle, along with another muscle underneath the shoulder blade, help to rotate the shoulder blade so that we can lift our arm overhead. So when the spinal accessory nerve is injured or weakened, the trapezius muscle can stop working properly, and it may be on one or both sides, depending on your surgery. So what we see is a droop in the shoulder. As shown in the picture on the top left-hand side, you can see this individual had a neck dissection on the right side and is presenting with spinal accessory nerve injury. And you can see that right side is more drooped than the left. And you can also see that the shoulder blade is kind of drifted away from the spine and sort of tipped downwards. As well, when there's injury to the spinal accessory nerve, lifting the arm, especially overhead, becomes very difficult. So you can see with this individual, he had a bilateral neck dissection and damage on both sides to his spinal accessory nerve, and he's having trouble lifting his arm even to the horizontal. Fortunately, the spinal accessory nerve most often recovers over time. However, it can take 12 to 18 months for the nerve to fully recover. And targeted exercises can help to minimize symptoms and restore function. Over the past 20 years, our team has been studying shoulder and neck problems after head and neck cancer treatment. We wanted to understand why these issues happen, and more importantly, what we could do to improve recovery and help individuals to get back to their usual activities and life roles. Those early studies helped us refine our rehabilitation program, and I'm just going to highlight a couple of these studies in the next few slides. One of the first studies we conducted was published in 2008. We wanted to know whether a structured strengthening program could help people who are experiencing shoulder and neck pain and weakness after head and neck cancer surgery. In this study, 52 individuals with head and neck cancer participated. Half received standard rehabilitation, which at the time at our center was simple range of motion exercises and strengthening exercises with light weights, while the other half followed a progressive resistance exercise program designed to, as I say, super strengthen the shoulder. So as Toby said, he's an athlete and he addressed his head and neck cancer as an athlete. As a physical therapist, I treat my patients as athletes. So I was thinking super strengthen the shoulder. So our question was, if we progressively strengthen the shoulder in a structured way, can we reduce pain and improve function? And what we saw was encouraging. Participants who participated in the strengthening program experienced significant reductions in shoulder pain compared with those receiving standard care. We also saw improvements in physical function and quality of life. And one of the interesting findings appeared when we looked a year later. Those who continued to exercise maintained better function and reported better quality of life. So the message from the study was clear. Targeted strengthening can help reduce pain and help people regain shoulder function. And continuing to exercise helps sustain those benefits over time. After our early rehabilitation studies, we also developed a community-based exercise program called Alberta Cancer Exercise, or ACE. ACE is designed to help people living with and beyond cancer participate in safe, supervised exercise in their communities. But we noticed something important. Many of our head and neck cancer patients weren't quite ready to join a general exercise program in the community. They were still dealing with shoulder dysfunction, fatigue, and reduced stamina. So while rehabilitation helped restore function, there was still a gap between rehabilitation or therapeutic exercise and full participation in community exercise for fitness. And that gap led us to another study called the Target trial. Target was a randomized clinical trial involving 61 individuals with head and neck cancer. Everyone in the study received therapeutic exercises for the neck and shoulder, similar to the rehabilitation program we used in our earlier work. But one group also added full body resistance exercise designed to improve overall strength and fitness. So the key question here was, if we combine targeted rehabilitation with whole body strengthening, can we help people move beyond rehabilitation towards regular exercise and physical activity? And here I just want to highlight the two pictures in this slide. The one over to the left, this individual, his spinal accessory nerve was recovering. He was able to get the arm overhead, and we were able to start some strengthening of the shoulder in the overhead position. And the fellow on the right-hand side was doing some specific trapezius muscle strengthening exercises as we were seeing recovery of his nerve. So our results with Target. We saw some encouraging outcomes. First, 97% completed the 12-week program, and even 1 year later, 85% were still participating. We also saw improvements in muscle strength and less fatigue, which is important for rebuilding overall function after treatment. As well, when the rehabilitation was combined with the full body strengthening, people not only regained function, they were better able to increase their physical activity over time. So we saw increased physical activity minutes being reported in those individuals who took part in the combined program. And that connects directly to the broader idea behind moving through cancer, making exercise rehabilitation part of standard care. Not everyone has access to a structured program like the Target study, but the message behind moving through cancer is that movement can still be part of recovery. If you're wondering where to start, keep it simple. First, talk to your care team about whether exercise is safe for you right now. Start small. Short walks, gentle mobility, or light strengthening. Third, build gradually. It's better to do a little on most days than to do too much all at once. And fourth, get support. Seek guidance from physical therapy, cancer-informed exercise programs, and community support. It can happen step by step, and it's important that movement is part of the journey through and beyond your head and neck cancer. Thank you.
Thank you so much, Dr. McNeely. That was very insightful, some great, helpful, practical tips, and your patients are certainly lucky to have you. And as several have commented in the chat, exercise isn't always available or even recommended necessarily, and we can certainly see how important those interventions are. So thank you again so much.
Thank you.
And now I am very pleased to introduce another one of our amazing ambassadors, Kim Barnard. Kim is a survivor of HPV-attributed tonsil cancer, which began in 2023 during a routine annual physical. An executive and senior oncology account specialist, Kim has long been committed to cancer patient advocacy alongside her husband, Cam. Both work in the pharmaceutical industry, but experiencing cancer firsthand has given that commitment an entirely new depth. Since becoming the patient herself, Kim has become even more deeply involved in advocacy efforts, and we are grateful for her participation and glad you're here today. Thank you, Kim.
Thanks so much, Amanda. I'm honored to join you guys. And yes, I am very much an advocate and appreciate the opportunity to just share a little bit about my story. We can move on to the next slide. So my journey began back in August of 2023 And that's a picture of my family. We had just completed, not too many months before, building a house and a barn. My daughter is an equestrian, and we took on the task of building on 23 acres of land. Had no idea what we were signing up for, but needless to say, it was a stressful experience. But we were settling in, and in August, I noticed a lump on my neck. And thankfully, I had my annual physical coming up and had my primary care physician take a look at it. And, he wasn't concerned. He's like, it doesn't feel like anything to be concerned about. You don't have risk factors. You don't have a family history. You're healthy. You're active. Let's try antibiotic. I think maybe it's just an infection, possibly a sinus infection. Let's try that and see what happens. So I did, and it did nothing. And so in following up with him, he suggested I see an ENT. And surprisingly, the ENT also felt like, after taking a look at it and inspecting it, all of that, that it also was possibly an infection. So guess what? He sends me home on an antibiotic, and this time prednisone. And neither of those worked. And the next step was he tried to offer me a third antibiotic. And at that point, I knew in my gut something was wrong. And I said no. So at that point, I requested to get some imaging done and go to the next step. We can advance to the next slide, please. So again, neither physician felt like it was anything to be concerned about. I had an ultrasound, which basically confirmed that I had, in fact, an enlarged lymph node. But then I had a CT, and the CT actually came back as concern for metastatic lymph node. And that was something I actually had to read in my chart myself. And I will say, I can remember the day like it was yesterday. It rocked me to the core, because as a healthy wife and mother and professional, someone who's very active, tries to be very, conscientious of my health, how I eat, cancer was the last thing on my mind. And I talk, cancer every day in my profession, but never in a million years did I think it was going to happen to me. So after I got my wits about me, I actually asked my primary care doctor to refer me to Duke to have my biopsy done. And that's where things started happening. The biopsy did confirm I had squamous cell carcinoma, and like Toby, it was HPV positive 16. And at the time my biopsy was performed, the primary was unknown. So the next step was to get in with a surgeon. And next slide. So my surgeon I met with on November 7th. My biopsy was October 30th. And so I was able to get in very quickly. And, one of the things with head and neck cancer is even though I was in the oncology space, I knew nothing about head and neck cancer. So I did have to reach out to some folks that I knew at Duke and try to get some recommendations, and got placed in the very capable hands of a wonderful surgeon who you'll see on another slide, a picture of he and myself. But when I went in to see him, he was 95% sure, based on examining me, talking to me about some of my, issues. Because really I had no symptoms other than the enlarged lymph node, but he was 95% sure it was in my right tonsil. And so I did get scheduled for surgery in December of that year. I had robotic surgery that removed both my tonsils and then 14 lymph nodes. And thankfully, no chemo was recommended for me at that point, at all to date. But I did have to go through 30 rounds of radiation for 5 days a week for 6 weeks. And, the first 4 weeks were great. Like, I wish I could say like Toby in week 6, I was great. But about that 4th week, the side effects started setting in. And it was, mouth pain, severe pain in my throat. It was very difficult to eat, drink. For me, it was one of my biggest challenges, honestly, was keeping weight on. And, as a woman, I haven't been able to say that in my adult years, but it really was a challenge to be mindful and thoughtful about what you could eat, first of all, and then what was going to give you enough calories. And at this point in time, also, I was doing a lot of reading around just diet and sugar and how, there's thoughts around sugar and cancer. And so it was a mental challenge for me too, because the things that would give me the calories were also high in sugar. And so it was very difficult for me to wrap my head around, how to navigate that. But I did finally get to a place where, I could consume some calories and managed to stay stagnant through the rest of my radiation. But I would say, starting 4 weeks and out, it was rough until about 2 weeks after I completed radiation. And then in terms of, side effects, and trying to manage those, it really was about trying different things. I don't know if I can mention products, but Helios was great for me. Baking soda and warm water helped, relieve the pain in my mouth. That really was my number one side effect, with some fatigue. But I'll talk about how exercising really helped me overcome that. Next slide, please. So I'm not going to go into a lot of talk about the Move-A-Thon, because we're going to hear more about that here in a little bit from Nancy. But that is actually a picture of me and my phenomenal surgeon, who I just owe the world to. I had such a great experience with my care team. And I did, towards the end of radiation, through my husband's company, learn about the Move-A-Thon. First of all, I learned about the Head and Neck Cancer Alliance, which, I hate that I did not know about when I first got diagnosed, because the wealth of information that I have been able to gain from being part of the Alliance, and then learning about the Move-A-Thon from my husband's company that year, was so timely for me, because I am someone who doesn't sit down on a daily basis. I like to take on everything. And for me, even in the worst parts of my treatment, as soon as I could get up and start moving, I was doing it. And because we own animals, horses, and have a farm to take care of, it got me moving. I didn't have a choice. And also, they're very therapeutic. So I wanted to walk from my house to the barn to see them. But then I soon learned through the Move-A-Thon how important exercise really is for recovery. And thankfully, I was someone who made myself get up and start moving already, but the Move-A-Thon just helped me take that a step further. So I completed treatment around February of 2024, and the Move-A-Thon was just starting to get legs under it for that year, late March, I believe, and then into April. So I was really at a point of taking it to the next level with the Move-A-Thon that year in 2024, right after treatment. So again, I'll talk a little bit more about that later. Next slide, please. So these are just some pictures that are, kind of inspirational and part of my journey. The picture there on the left is with one of our horses. And as I mentioned, they are very, very therapeutic. And that was actually right at the end of my journey. And I spent a lot of time at our barn. That helped me heal. In addition to the moving and the exercising I was doing, that was great therapy for me. That is me ringing the bell in the end of February of 2024, which was a wonderful day because I had completed radiation that day and so happy to be done with it. And then the picture there on the right is my wonderful family who was very supportive throughout my journey and continues to be, because it's still, it's still recovering, even 2 years later. But I'm happy to say in my 2-year follow-up, about a month ago, was still no evidence of a disease. So I'm super excited about that. And as I mentioned, my journey just made me realize how important education is, how important awareness is, and patient advocacy, because even though I'm in this type of role, the type of role I'm in every day, I didn't know about head and neck cancer, and I didn't know all the things I needed to know in getting the diagnosis I had, and really had to advocate for myself. And I think, and going through that process, I just kept thinking about all the patients that don't know how to do that, or don't have the resources or the support system to do that. So it is very important to me to be an advocate in that capacity. And I think there's one final slide. I have amped up my activity and fitness since after treatment. I really have gone from practicing yoga a few days a week to now I'm strength training, which it's the first time in years in my adult life that I've gone back to strength training. But it's something I know as I age, it's very important, but it keeps me active. Also, I try to get in cardio several times a day. Tai Chi, which is, wonderful for your lymphatic system. Something that I've recently incorporated. And then I don't know if there's any equestrians on here, but if you are on here, if you own a barn and you have horses, you're doing a lot of daily work trying to maintain that. So I do stay very active, and I 100% think that helped me recover as quickly and as well as I did. And it's not to say I don't still have some challenges. I do. I still have pains in my jaw. I have trismus. So going to the dentist or having a big burger is not always something that's easy for me. And I do have, days where certain things will burn my mouth and not be comfortable. But overall, I'm very thankful, very fortunate for the recovery I've had. And I just appreciate getting the opportunity to share my story with you guys. Thank you.
Thank you so much, Kim, for your valuable perspective. And we're so glad that you found the Alliance, and we are so glad that we found you. You're just a tremendous advocate.
Thank you.
So grateful for you. And now we have a little time for Q&A before we launch into the Move-A-Thon. And so I'll share some of the questions that have come in. And this first one might be for Dr. McNeely, but also I think Kim and Toby, feel free to chime in. Is it safe to exercise during treatment or right after surgery? And does walking really count?
I'm going to say, I think our surgeons here for sure want people to start moving right away. So the goal is to get people after surgery up and moving, try to prevent some of the complications that happen after surgery, which could be things like blood clots or pneumonia. So generally, we're getting people up right away after surgery and trying to get them moving. And I hear back from a lot of the patients to say they get up and walk around the ward, So if there's any issues, usually the surgeon will call it and say, I don't want you to move for this reason. So they'll give you some clear guidance, but usually we're getting people up and moving right away.
Yeah, I will say I was one of those people. Maybe not as much at the hospital. I mean, I did get up and move, but when I got home within a couple of days, I was walking to the barn and just walking, nothing strenuous, but absolutely getting out in the fresh air and moving around a little bit absolutely helps.
I was never a walker. I always thought cycling was enough, but when I had a prostatectomy, and I couldn't cycle, you can't cycle for a couple months when you have a prostatectomy. I took up walking, and I do it every morning now. I can't stand starting a day without it. And there I was after that prostatectomy in August with a catheter and a bag, and I went for my walks every day, and I 7 years later, I love it.
Thank you. And this ties into some of what we talked about tonight with regards to maintaining weight. Should exercise be avoided if someone is already underweight?
I'll take that one. I dropped about 10 pounds during my cancer journey, and that doesn't sound like a lot, but on my frame, it was a lot. And I think if you just balance adding extra calories, which I did have to do, it didn't stop me from exercising. And I don't think I wasn't doing strenuous exercising, just walking and being active. You're not burning near as many calories. I didn't start doing the intense stuff for probably a good year after my surgery. So I think it's very manageable as long as you're not doing super intense activities.
And I found that moving and exercising really activated my metabolism, and it allowed me to take on fuel and build my body back. I lost about 30 pounds after surgery. I was sure it was muscle mass, but as soon as I started moving again, the muscles reactivated, and I was able to get back much quicker. And I gained 20 pounds back in a matter of probably a couple months.
And I can just add to that. When we first started to do research with the head and neck cancer group, and we wanted to do exercise, and I was proposing that was one of the concerns that came from both the oncology teams and the patients was, well, if we start to exercise, we're going to lose even more weight. And so as part of our original studies, we weighed people at every session when they came in so we could monitor their weight. And in fact, we saw the opposite. Patients were reporting they actually were hungrier, so that made them want to eat, and they were sleeping better. Mm-hmm. So two small little things we noticed right away. But as I said, that was a concern initially when we started our work looking at exercise.
Thank you. And there was some conversation about physical therapy and kind of identifying resources in the community. I don't know that everyone has access to the kind of physical therapy, especially focused on the head and neck cancer patient population. Do you have any resources or advice, Dr. McNeely, for connecting with the broader physical therapy community to find those resources?
Yeah, so if you do have a physical therapist in the community and they're not familiar with head and neck cancer, again, most of my publications and that are available, like freely accessible online, and they are written with the intent to be implemented. So a lot of the prescriptions in that are actually in the paper or in the appendices, and certainly any physical therapist can contact me, and I know a couple have recently, I think, seeing me on this Move-A-Thon, and ask for some direction. And so we're always happy to provide that.
Thank you. And just a few more questions. How do I start exercising if I haven't been active in a long time?
Walking.
That's the basics, right? And talk to your doctor. The guideline, Dr. McNeely, I have not read it, but I've heard you talk about it and other doctors talk about it. Is that a place to look to kind of give the beginner, intermediate, advanced levels to help somebody get started and progress?
Yes, absolutely. And the ACSM has some tools on their site that you can download. So you can look at the different symptoms you may be experiencing, and it will tell you, okay, if you start with just an aerobic exercise prescription, what should that look like? Or if you're going to do combined aerobic and strength training, what does that look like? So there are those resources through the American College of Sports Medicine and the Moving Through Cancer initiative.
And a good physical therapist is going to they start at the real basics too, right? And they'll get you off to a gentle start that works for you. And if you work with them and give them feedback, you'll find the fit.
And one final question, can caregivers exercise alongside patients or survivors, and how do caregivers encourage movement without pushing too hard?
I guess I can start there too, if you want me to. I was going to say, when we do involve the caregivers, it's great because a lot of times too, they're pretty stressed by the whole experience of seeing their loved one go through cancer. And so if they can also do something for their fitness, or they can do things together, it's great to also involve them.
Yeah, not just the physical side of it, but the mental, emotional side of it is to enjoy it with your better half or whoever your caregiver is. Boy, that's that can be a big boost across the board. So it's the right idea, and I'd strongly endorse it.
Great. Thank you. One last question. Does physical activity help with neuropathy or balance issues? Any studies or experience with that?
Definitely. I mean, we're getting some emerging research evidence in terms of the benefit of exercise for neuropathies. Right now, it seems to be primarily focused on aerobic exercise, but that's where a lot of the studies have been. But definitely, in our experience, can be helpful. We do a lot of also hand and foot exercises in our program. So really focusing on the areas where the neuropathy is, because we often see some muscle wasting, which can then affect your balance as well. Not only the sensation loss, but also the muscle and the proprioception changes that come with that neuropathy. And balance, I always say, very trainable. So something that's really worth focusing on.
Great. Well, again, I would like to thank everyone for participating today. Our ambassadors, Toby Hanna and Kim Barnard and Dr. Margaret McNeely. It's just been a really powerful session and great timing with April Awareness Month coming up in the Move-A-Thon. So thank you so much for being on the panel and sharing your insights and your knowledge and your lived experience. And a special thank you to the American Head and Neck Society for partnering with the Head and Neck Cancer Alliance and organizing and hosting this webinar. And we will have the recording and the slides available on our website soon. So we're going to provide some information about the survey, and we really do appreciate you taking a few moments to share your feedback, because that input helps us understand how we did and how we can improve future webinars. And I think that is in the chat right now. And now I am delighted to introduce my coworker, Nancy Bonfield, our Alliance Development Director, whose leadership and vision was pivotal in launching the highly successful Move-A-Thon event 3 years ago. And we are excited to have her here today to talk more about this year's Move-A-Thon. Thanks, Nancy.
Thank you so much for having me. Thanks for joining us for the Move-A-Thon Kickoff. If you just joined us for the webinar initially, don't you dare go anywhere. Stay with us to celebrate you and everyone else. We are truly grateful to have you with us today, and we're excited to share more about the Move-A-Thon and the meaningful impact it continues to have across our Alliance family. I'm ringing my bell today for all of us, and I know you cannot hear the bell, and I'm sure you're grateful. But this is to encourage you to learn more. Thank you for the 30 plus teams who have joined us already as of today, and almost 100 people registered, and it's still March. If you haven't joined the Move-A-Thon yet, the great news is there is still time, and it's not too late. For those of you that are new to our community, For those of you that are new to our community, the Move-A-Thon is one of our signature events, bringing together patients, survivors, caregivers, clinicians, supporters all over the country with one shared purpose, and that is to move with intention and create hope together. As you've heard the panelists before, just movement encourage them throughout their journey. And this event is virtual, where people can register for free, share and increase their impact through moving the entire month of April while improving their journey. Sorry, I don't know why that keeps going backwards. There we go. All right. So I'd love to have everyone on the call grab your phones right now and scan the QR code, or you can click in the chat the link if you were better at that and don't want to pull out your phone. But this will bring you to the Move-A-Thon page, where you can learn how to get registered, editing your page, ordering t-shirts and signs, learning about support calls. All of these things are happening, and it's on that page. So much is happening alongside the virtual event, and it's so exciting. We have corporate teams such as Johnson & Johnson hosting personal company Move-A-Thon walk events. The city of Pompano Beach is actually hosting a community walk, and they are providing screenings during that walk. Brian's support squad is coming together every year to honor Brian's life alongside his late wife and his son in loving memory. And we have a new team hosting a tennis tournament for a Move-A-Thon event. All of these moments remind us that while we may be spread all over the country, our community is coming together and moving as one. The kickoff's designed today to, one, celebrate the 30 plus teams and 100 plus individuals already registered, getting familiar with the Move-A-Thon, inspiring you all to join us, hearing from others how the Move-A-Thon has impacted them, and lastly, sharing what's new this year. The Move-A-Thon is about moving, but it's more than that. It's about your movement. It's about restoring strength after treatment. It's about supporting one another through the hard days. It's about honoring those that we've lost and those that we love who've gone through this journey. It's about sharing your voice and raising awareness. With that, it supports funding critical programs for the head and neck cancer patients, such as patient education, caregiver support, survivorship programming, and early detection and awareness efforts. While fundraising is encouraged, it's not required. We never want fundraising to be a barrier to participation. I would love everyone participating in this event and choosing to move with us because that is what matters most, is that you participate in whatever way feels right for you. Every action, big or small, helps move this forward and our mission forward. And just as importantly, it reminds every person here impacted by head and neck cancer that they are not walking the journey alone. One of the most powerful parts of the Move-A-Thon is hearing directly from those who have been touched by this event and this community. Today, I'm honored to have Kim and Toby join us to share more about their movement and how the Move-A-Thon has impacted their personal journeys. And I would love to have Kim join us again to share her heart. Kim, welcome. Thanks. Welcome back.
Thank you, Nancy. I know, as I mentioned to you guys before, I was very fortunate to learn about the Move-A-Thon very close to my treatment ending. My husband had joined Coherus as a representative there, and they were just starting to have talks about their team. And that really is where I learned about the Move-A-Thon and what it stands for. And I was so passionate, again, coming out of my journey, just wanting to advocate for other patients and make a difference in this community that it represents the Move-A-Thon. It's so many people wanting to do the same thing. Like, we just want to get the word out, raise awareness, hopefully create funding to help support some of this awareness. And that first year, we decided to join the Coherus team together. And I believe we raised over $2,000, just Cam and I, that year, which we were super excited about. And then last year, we decided to do our own team. So we formed the Hope in Motion team, and we did do some fundraising, although not quite as much as we did the year before. But I am happy to say that I was, I think, the third highest individual mover. So I did contribute a lot in that way last year. And then this year, I decided to join the ambassador team. That was a newly formed team for 2026. And I really want to join my fellow ambassadors on that team this year, and hopefully attack it from both sides for fundraising as well as movement this year. But I will just share that picture there on my horse. I was actually in my 4th week of radiation, and that was just, I had learned about, at that point, I had learned about the importance of movement, and any movement. It doesn't matter what you're doing, whether you're walking, whether you're playing with the dog, whether you're on the back of a horse, any kind of movement counts. And it, as I shared in my story earlier, it really, I'm convinced 100% helped me recover much faster than I would have had I not been moving continually throughout my journey. So this is a great cause. Something I'm very passionate about, and hope that, the folks on here get just as passionate about it, because it's going for a great cause. So thank you, Nancy, for giving me a chance to speak again.
Thank you. And we are so grateful for you and for you finding us, and grateful for your voice. So thank you. And next, we'll hear from Toby, whose journey really reflects the spirit of moving forward, literally. Toby, thanks for joining us again as well.
Yep. And I found my Move-A-Thon shirt, right, Nancy?
Nice wardrobe change. Nice job.
Had to do that appropriately. Thank you. And nice job, Kim. It's always great to hear other stories, and yours is, I've heard a couple of times, but I keep learning new things about you. It's great. I mentioned my natural inclination to give back using the experiences and compassion that I've found from my cancer journey. So last year I channeled some of that into Head and Neck Cancer Alliance's Move-A-Thon, and was really humbled by the response, and had a lot of fun. We pulled together a campaign under the name Team Pain in the Neck. We raised money for the Alliance, and importantly, we grew that community of people that recognize the positives of exercise in head and neck cancer. We logged almost 13,000 minutes of exercise during the month of April last year. We had friends and family, of course. I had teammates from my cycling team. Had patients that were undergoing treatment in the month of April last year that found it really helpful to have this to focus on and think about and do and move, and so all inspiring. So we are jumping back in this year, and here's a shameless plug. Please scan the QR code. It's different than the QR code that Nancy showed. This will take you to the Team Pain in the Neck page, and we'd love for you to join us. Join any of the teams, or be an individual member. But certainly, if you're interested in seeing more about Team Pain in the Neck and getting us off to a good start this year, I just got the page up a week or so ago, and am sharing it around now as we come up on April 1st. And lastly, a funny story I always have to tell when we're talking about this. Nancy's heard it before, but bear with me. We got the team name, Team Pain in the Neck, from our first meeting, my wife and my first meeting with the leader of radiation oncology at our county hospital. And this was right after I was first diagnosed, and we were figuring out treatment and, the vertical learning curve that we're all on at that point. We sat down with the doctor, and he started asking the usual questions. The second or third question was, "Do you have any pain in your neck?" And my wife, Peg, raised her hand and said, "That would be me." We immediately became humans again and laughed for about 5 minutes with Dr. Greenberg. And then we went back to figuring out how to cure cancer. So if you like that story, then there's all the more reason to scan that QR code and support Team Pain in the Neck. Thanks, Nancy.
Thank you, Toby. And we're grateful for you and Peg. I've made Peg get on calls to say hi to me too when I'm dragging Toby, into this Move-A-Thon-ness, and just grateful to have both of you and honored to have you moving with us. So thank you. So, when we began this Move-A-Thon about 4 years ago, I recall a conversation, a personal conversation with a 20 plus year survivor. And I'm just so grateful to be able to bring this to many of you, because when I was having that conversation, he was so grateful for the opportunity to be a part of something that impacted head and neck cancer patients. And that's powerful as an organization, to be able to bring something to your survivors and your patients that are going through something that they want to give back to head and neck cancer patients specifically, not an overarching cause that maybe they can't help someone just like them. So just honored to have this opportunity and bring this to you. As we look ahead to April, it is around the corner, but we still have plenty of time to get started and plenty of time to grow our teams. So couple ways to be involved. Register, whether you join Toby's team or you join Team Impact, which is the Alliance, or start your own. Invite others to join you, challenge others to host teams, consider hosting a walk or opportunity. And I'm happy to share that there's a couple of new things to share about, and all of those things are on the Move-A-Thon page, as noted on the slide. But we have teams can be sponsored by local businesses. So this is a way where local businesses that you support all year long can support you. So if you see the screen example on the far side, it says become a sponsor, become a team sponsor. This is a link to share, to reach out to sponsors to sponsor your team. If you need any help with that, I'm happy to do so, and you can reach out. We will have signs, yard signs and selfie signs for our Community for Awareness Month and Move-A-Thon. There's the beautiful sign example on the slideshow. And these are going to be downloadable, so you can have them printed locally, or you can order the signs from us specifically if that's easier for you. Those will be available this week on that page. And lastly, we have our shirts. We all have been wearing our shirts, the webinar presenters today, to order if you choose. This is a choice again, but all of these things are available for you to utilize in your communities. This year, our shared goal is to continue building that momentum, not just in miles or dollars, but in community and hope. We would love for you all to be a part of this momentum and be a part of the Move-A-Thon. So scan the code, click the link to join us, and we really can't wait to see the incredible momentum. Before I close, I want to say thank you. I want to say thank you for the miles you've walked already. Thank you for the stories you carry and share. And thank you for continuing to move forward with us. At the Head and Neck Cancer Alliance, we truly believe every move matters. We are honored to move alongside each of you this year and beyond the Move-A-Thon, every single day of your journey. And thank you all of our speakers for joining us today. And we appreciate your support. And thank you for our Move-A-Thon sponsors. We look forward to moving with all of you. Have a great night.